and a regular QRS complex, meaning the distances between P waves from one P wave to the next P wave and from one QRS to the next QRS should be equal. The rhythm or the distance should always be equal. If their distances are not equal, something is definitely wrong. And please remember that your PR interval and the QRS intervals should be also within normal limits. And I hope that was discussed what those normal limits are. And the relationship of the P wave to the QRS complex should be 1:1, meaning one P wave, one QRS complex. And another thing, the P wave should always come before the QRS complex. Does that make sense? Why should the P wave come before the QRS complex? Because the P wave is atrial depolarization. Very good. Okay, you guys are good. Okay. Okay, also examine the morphology of the P wave. The P wave should always be, if it's from the SA node, it should always be upright. Why? Why should it be upright? Okay. I'll tell you this, guys. If you can master ECG and retain that knowledge all the way through med school, you will be better than 70% of doctors out there. There are lots of licensed physicians who don't know how to read an ECG. They learned about it in med school, but they didn't understand it and they forgot about it. Okay? Okay. So going back. Morphology. For example, this is a positive lead. Okay, and this is the negative pole of a lead. Okay, bipolar leads, right? They have two poles. If a wave is going in this direction, what does the wave look like? Is it going upward or downward? Very good, right? It's going upward. In the case of, however, if the wave moves in this direction, away from the lead, what does the wave look like? The wave is downward, here it's upward, right? Now, why is the P wave, to be normal, why is it upward? Okay, art is not one of my strong suits, okay? My God, what does that look like? My God, the atria are bigger than the ventricles. Okay, please excuse my drawings. Okay, the SA node, okay, the AV node and the Purkinje fiber. I bundle his and the Purkinje fibers. Why is it upward? Because, remember, when we talk about ECG, the lead usually is somewhere around here. The mean vector, right? You talk about the mean vector? What degree is the mean vector? 60 degrees is the normal. 59 to 60 degrees is the normal vector. So because the normal direction of depolarization from the SA node is in this direction, what should the P wave look like? It should be positive. So that's the reason why the P wave is always upward. But what if you see an inverted P wave? Is that normal? That's not normal. Okay? And we'll talk about that a bit later. There are actually conditions that would cause an inverted P wave. P waves are best seen in the inferior leads, okay, 2, 3, and ABF, and in the chest leads, V1 and V2. And QRS complexes are readily visible in all leads. Okay? So here's an example of a normal sinus rhythm. Don't mind the music. Okay? Notice, normal sinus rhythm, the P wave will always precede the QRS complex, followed by the T wave. What's the T wave? Ventricular repolarization. Okay? So as long as you see that, and if you see that the intervals between R and between P and the next P more or less look the same, then you're probably looking at NSR or normal sinus rhythm. Okay? So I have a video here. I think the speaker's enough for
is called normal sinus rhythm. The heart's pumping action is driven by electrical stimulation within the heart muscle. The heart's electrical system allows it to beat in an organized, synchronized pattern. Every normal heartbeat has 4 steps. Step 1. As blood flows into the heart, an electrical impulse from an upper area of the right atrium, also known as the sinus node, causes the atria to contract. When the atria contract, they squeeze the blood into the ventricles. Step 3. There is a very short pause, only about a fraction of a second. And step 4. The ventricles contract, pumping the blood to the body. A heart normally beats between 60 to 100 times per minute. Electrical signals in your heart can become blocked or irregular, causing a disruption in your heart's normal rhythm. When the heart's rhythm is too fast, too slow, or out of order, an arrhythmia, also called a rhythm disorder, occurs. When your heart beats out of rhythm, it may not deliver enough blood to your body. Rhythm disorders can be caused by a number of factors, including disease, heredity, medications, or other factors.
Okay. So that's the introduction to arrhythmia. Remember that the heart maintains that normal sinus rhythm, that normal transfer of electricity throughout the heart to maintain its normal function. Okay? What's the normal sequence? The atria must contract first before the ventricles. And then there's what's called a physiologic delay. Where does this physiologic delay take place? In the AV node. What is that physiologic delay? What's the value? 0.16 seconds. Very good. That 0.16 seconds enables the ventricles to fill with blood before they contract. Have you discussed heart valves already? How the heart valves have different pressures? Okay, good. So you know that the changes in pressure of each chamber is responsible for the opening and closing of the valves. Okay, I am absent-minded. Where did I put my clicker? Oh, there it is. Okay, so an arrhythmia, as the name implies, okay, meaning that there's technically no rhythm. So an arrhythmia, we could talk about an irregular rhythm, or you could have an abnormal rate, or you could have a conduction abnormality, or if you are unlucky, you could have all three. Okay, so a definition is an abnormality of rate, regularity, or the site of origin of cardiac impulse, or a disturbance in conduction that would cause an abnormal sequence of activation. So remember, the normal pattern of SA node, AV node, and ventricles will no longer, or sometimes does not occur, if there is an arrhythmia. And we'll see how that happens later. Okay? So note that there is a clinical classification for your arrhythmias. You either could have an increase or a decrease in the heart rate. Basically, in medical terms, your tachycardias and your bradycardias. Okay? You could have heart rhythm irregularities, or it could be regular, but the heart rate can be increased. That's still an arrhythmia. Any heart rate